Hello everyone. Crystal is otherwise occupied today, so I'm super excited to be back and super excited to have our guest Cal join us tonight. So I will just give a second for everyone to pop on and then have Cal hop in. We're going to be talking a little bit about chiropractic medicine tonight, and Cal has a ton of experience in the medical field and knows a lot about like sort of physical wellness, nutrition, and that sort of thing. So super excited to debunk some myths tonight, talk a little bit about wellness. So let's have Cal jump in and introduce himself.
Hey, how's it going?
Hello.
How are
How's it going?
Going well.
Awesome.
A little bit about me is that I graduated from Penn State in 2016. I'm currently a student in the Doctor of Chiropractic. I'm going to be a third-generation chiropractor. I'm also getting my master's in applied clinical nutrition, and I'm also getting certified in applied kinesiology. I just want to give a shout out to Christopher Singh, also known as the exercise scientist. He is the one who recommended me to get on the show with the Speak.Wellness.
Awesome.
And after watching a couple of your guys' live shows on Tuesday, definitely honored, and thank you for having me.
Yeah, absolutely. We're excited to have you. And I know Crystal's bummed that she can't be here, but I'm sure we're going to have an awesome talk. So you have a ton of experience in like different areas of sort of medicine and like health and wellness. So why don't you start off by telling us a little bit about like your journey to like choosing that career? It sounds like it's a family business, which is super cool. So I'm sure that had something to do with it, but why that path as opposed to straying from what everybody else did?
Sure. No, that's a great question. Basically, it does run in the blood. My grandfather, Dr. Arnold Forster, was kind of the founders. He treated a couple of the presidents of the graduate school I went into, and my father just kind of took it and ran with it. He is also one of the owners of a supplement company called NutriWest. So between not having to be on medicine myself and doing everything very organically and holistically, and knock on wood, I had mono in 2016, and since that day, was it 2023? I don't remember the last time I was sick or had a sick day. So it really just shows you, and I fell in love with it. I like to think of we're detectives, human being detectives, and there's this quote unquote word that everyone says is find the root cause. So if everyone has a cough or a sneeze, it could be coming from a million different reasons, and I have a lot of fun finding out the reason why, rather than just hoping the symptoms go away and feeling like a victim. And I want to empower our patients, not for our patients to feel bad.
Sure. So talk to us a little bit about what your treatment approach looks like. How do you see somebody with an ailment and go about like having them achieve sort of wellness beyond just like that one treatment interaction?
Sure. So it essentially goes through 3 scales. The first is there's a concept called viscerosomatic, somatic visceral psychological, or psychological visceral. So it's either emotional, musculoskeletal, or organic. And based off trying to figure that out through a concept called applied kinesiology, I do more of clinical kinesiology. Follow that up with certain tests, whether it's stool tests, saliva tests, blood tests, urine test, you name it, and find a combination. And also take an extensive history, you could find out a lot of the reason why, which is kind of a big thing of why the whole presentation was Forster Your Awareness, where I feel like there's a lot of myths out there to debunk, and a lot of people feel that they can't do certain things because they're diagnosed with a certain disease or condition or whatever. So, for example, once we get a little further into it, a common trend that I found that I had a harp on for today is a lot of patients come in and they have high cholesterol. My doctor says I have high cholesterol. And one of the biggest culprits of death in America is having heart conditions and heart diseases. And there's this thing that it's because I have high cholesterol. So it's one of those things where it's like, okay, that may be true. You might have high cholesterol. Maybe that is. But what's causing that? Why? And that's digging deeper into the further depth. And that's probably partially alluding to that I plan on being a functional medicine practitioner after I graduate from all of these things starting in January.
Yeah. So talk to us a little bit more about some of the myths that you feel like you see a lot and how you go about debunking them with your patients. So you talked a little bit about high cholesterol. Like, how would you say that presents itself clinically?
Sure. So we could go through the high cholesterol and whatever. Other times I'll hit on like soft other topics.
Sure.
I think this is a good one to go over because for every doctor in America, this is inevitably going to come in multiple times a week. So the way I like to think of it is I want you to pretend you're an alien from outer space, okay? And you have no idea society of how it looks like on Earth. So if you're looking out and you look down onto Earth, you see a car accident. You see that there's a car accident. So if there's a car accident on the highway, who do people call? They call 911, and who shows up to an accident?
EMS, fire, police.
Exactly. Police, ambulance, EMS, you name it, right? They come onto the scene, and what are they trying to do? They're trying to clean up the car accident, right? So if you didn't know any better, if you're this alien from outer space and you don't know how society works, you can see car accident here, and you can see ambulance cars here. And if you didn't know how society works, you might think that the ambulance caused the car accident. You see both. You see both on the street, right? So you have to think of it as kind of like that. So now let's change it up. So you go to the doctor's office and you're really sick, and then all of a sudden you take a blood test and it says high cholesterol. If you didn't know any better, high cholesterol, heart condition. So it must be that the high cholesterol caused a heart condition. You see the difference? So now you can think of high cholesterol like the ambulance cars. So now what do people do? They try to take away the cholesterol, whether it's low-fat diet, the DASH diet, decreasing your sodium, or whatever medication, or whatever it may be that cause the cholesterol go down. But now you're telling all the ambulance cars, get out of there. You're the reason why. Right. And if you're not saving the day, what's going to happen? There's going to just be more car accidents.
Right.
So what I'm getting at is, if I'm saying cholesterol is the good guys, then what is cholesterol? Like, what is it? I have high cholesterol. What does that even mean, right? So cholesterol is actually a transport mechanism. It's a type of fat that transports every fatty acid in your body. And what does fatty acid become? It becomes different types of hormones. And so if I didn't know any better, I think all men want to keep their testosterone levels up. Women want to keep their progesterone and estrogen levels up. And we have this whole thing going on in America with hormone issues. But guess what makes hormones? Cholesterol, known as 7-dehydrocholesterol. Also, another big thing is everyone wants to get their vitamin D levels up, right? Vitamin D3, you got to get your D3 levels up. It's good for your bones, good for your health, good for your immunity. Guess what makes vitamin D? Cholesterol. So you're telling me the thing that makes vitamin D and the thing that makes testosterone, estrogen, progesterone, all your other hormones in your body is the thing we want to take away? Does that make sense?
Well, and I think that speaks to a lot of like the miscommunication that happens between doctors and patients, right? So like your analogy of like being an alien who comes in and sees these two things that are coexisting in space, right? Like an ambulance at a car accident. Yeah, I could understand how you might be like, oh, ambulances, car accidents, that's all I understand. Like, I guess they exist together.
You got it.
Right? But it's true that you can have higher levels of cholesterol and be otherwise totally healthy, right? I have this argument with people all the time about BMI scales, right? The way that we establish BMI, right? It's like height, weight, whatever. vast majority of people are considered overweight or obese according to their BMI in America, not because they're in actuality obese or overweight, but because the BMI scale that we use is totally outdated. Exactly. And based on anything that represents modern day human bodies, right? We are significantly taller than we used to be. We're significantly more muscular than we used to be years and years ago when these scales were established, right? So I think a lot of these myths that get misconstrued, especially in the medical world, have to do with a lack of explaining to a patient, like, okay, you have high cholesterol, but what does that mean, right? It's not an if this, then that, right?
So to speak to that is, with whether it is BMI, like you said, or cholesterol, what I'm saying, there is some truth to it. That people who are overweight or obese, severely obese, do have a higher BMI. People who do have high cholesterol, there are bad types of cholesterol out there. So I could allude to that. So, for example, a lot of people, what we learned in school is that there's HDL, high density lipoprotein, which are considered the good guys. And then there's low density lipoprotein, which are considered the bad guys. So the idea is like, let me lower the LDLs. But this is what they're missing. There's always a level deeper. And there's actually two types of LDLs out there. It's called apolipoprotein A and apolipoprotein lipine B. So so just to make it easier, we're going to do A is the good LDLs and B is the bad LDLs. So the way to think about it is that you can think of LDL as this like big, fluffy, airy, healthy LDL. And an LDL-B is, think of it like a heavy, small golf ball. So if I threw a fluffy air beach ball at you, would that hurt? No.
Probably not.
But what if I chucked a heavy, small golf ball at your head? Would that hurt?
Probably.
That's right. So there you go. So it's broken down to good and bad. So when you bring down LDL, you're bringing the bad guys, but you're also bringing down the good guys. So the whole question then becomes, if there's good LDLs, there's good HDLs, there are some bad LDLs out there, what is causing all the heart conditions? That's the real question. It's not really like cholesterol. So what is it? So the answer is a different type of fat. The answer is called triglycerides. So triglycerides is a measure that you can check on blood tests that comes from sugar. So the way you got to think of it is, a kid comes to a dentist, right? And they get diagnosed with a cavity. What do they do at a hygienist, at a dentist? What do? They put a filling in the tooth, right? And give them a lollipop on their way out. But why did that kid have a cavity? So sugar is sticky. So if I told you to take a sugar stick and dump it down your throat and then eat cotton candy, what do you want? What drink do you want to have right after?
Probably water.
Right, water. Why?
Because
your throat's dry.
Right.
Why is it dry? Because it's sticky.
Right.
So it's the same idea. So when a kid has a cavity, they say it's due to the bacteria on the teeth, right? But what did the bacteria stick onto? Sugar. Bacteria sticks onto the sugar sticks onto the teeth. Sugar is sticky. It's like glue. So the bacteria sticks onto the sugar sticks onto the teeth. That's what causes the cavity. When you swallow sugar and it goes into your body, if it's sticky and it goes into your bloodstream, what do you think the triglycerides or sugar is sticking onto? The walls of the blood vessels, right? So now the walls of the blood vessels are sticky, right? So now you got these big, fluffy, healthy cholesterol that's transporting all these great hormones and vitamin D and bringing it around. But now if you have these lipoprotein B heavy golf balls that are heavy and sink down and get onto the wall of the blood vessel, what's going to happen to it if it's a sticky blood vessel wall?
The cholesterol is not going to get through.
Exactly. It's going to get stuck.
Right.
That's known as arterial plaquing. So you know when people get like a stroke or a myocardial infarction, it embolizes and goes? That's what it is. It's cholesterol that's trying to transport amazing things throughout the body, but now it's getting stuck because the wall of the blood vessels is sticky. And it's sticky because of the sugar and the triglycerides.
Right. So what do you tell people who come to you and say, you know, I went to the doctor, they told me I have high cholesterol, I have to adjust my diet, I have to do this, that, and the third, but you're looking at somebody who looks otherwise healthy, right? Or you're looking at somebody who's saying, oh, I had no idea I had high cholesterol. I went and got my routine blood work done, and now I have high cholesterol, and now I'm worried I'm going to have a heart attack. What do you tell them?
Well, I would like to say, let's break down what the cholesterol is. How much high density lipoprotein do you have? How much of that lipoprotein A do you have? How much of that apolipoprotein B do you have? How much of that very low density lipoprotein do you have? It's all about ratios. Mm-hmm. It goes for anything in this world. There's good healthy proteins, there's unhealthy proteins. There's healthy fats, there's unhealthy fats. There's healthy carbohydrates, there are unhealthy carbohydrates. That's why it's like everyone likes to take one concept and run with it. And the reality is everything there's good and bad of both. And the same thing goes for cholesterol. So let's find out what your ratios are. If the ratios are a lot of those golf balls and a lot of the VLDL, we got to change some things. But what if it's heavy on that big fluffy volleyball, apolipoprotein A and HDL? I say keep eating your avocados and drinking your extra virgin olive oil and eating your walnuts. Right. And I say not to worry. And then I take a saliva test and check their hormones, and I see they have great healthy hormones. Right. And then I give them vitamin, and I'm giving them vitamin D, and their vitamin D levels are up, and they feel great. So they're so worried about their cholesterol. And then I would say, are you feeling like you have heart conditions? And if the answer is no, then what's so bad about the cholesterol? What am I missing?
Right. And I think you make such a good point about like the universal approach to things, right? Like people are so quick to say, oh, I have high cholesterol, I need to stop eating fats, I need to stop eating eggs, I need to stop eating avocados, right? And I think that's something that Crystal and I do a lot with when we're working with Total Transform. We have a lot of women who come to us and say, oh, I need to cut out carbs, I want to lose all this weight, right? Or, oh, I need to stop eating fats because I need to lose all this weight, or I need to gain muscle, right? And the reality is like, it's maybe not that you need to stop eating something or eat more of something else. You maybe just need to establish more equilibrium in your body so your body can do what it needs to do and grow the muscle you want to grow and burn the fat that you want to burn, right? It's not necessarily about getting rid of things or, having excess of other things. It's about moderation. And that's the biggest thing that we find that we're sort of educating women on in our program is talking about, like, you don't have to eat 1,000 calories a day to lose weight. In fact, you shouldn't. You should be eating enough calories for your body to be able to build muscle, right? And I feel like that is a huge misconception that people have.
It's like let's say, so we live in a society, as I like to say, that we're overfed, but we're undernourished.
Right.
So the idea is like calories. So in a vacuum, you're absolutely right, calories. And if you say 100 calories in, 100 calories out, but how the body works, the body isn't a machine that burns calories. Mm-hmm. Food is medicine, and what we're eating and what we put into our body is sending signals all throughout the body of how to absorb. So for example, if you did 100 calories of MCT oil, it doesn't even go into the body. It goes straight to the liver to make ketone. And if you do 100 calories of a bagel, it gets converted to that triglycerides, that gets converted to that sugar, and then it makes everything sticky.
Right.
So that's what it becomes. And the truth is, the reason why certain things get promoted and certain things not is take a guess what the reason is.
Right, money.
So how much money is anyone going to make if I told someone to eat broccoli instead of a cookie?
Right.
Does anyone off of that? No. But what is their money on lowering cholesterol?
Right. Well, we did an episode a few months ago on Ozempic and how so many practitioners were pushing Ozempic not only for its initial clinically researched purpose, but also as a subsidiary of weight loss, right? And like how so many people realize like, oh, well, I can take this medication and the side effect is that I'm going to lose a ton of weight. So guess what? Now we're prescribing this medication with the purpose of weight loss, right? And I think, we could have a whole different conversation about like, pharmacological pursuits and that kind of thing when it comes to money making. But it's so true that like I think sometimes bringing it back to avocados. I think bringing it back to food, right? Like there's a reason why in a lot of other cultures where they're eating healthy farm fresh foods, like they're healthier than we are in America where we're eating all this processed shit all the time.
No, of course. I mean, nothing, there's a time and a place for acute care and chronic care. Mm-hmm. In today's practice setting, the professor said if a patient can't count 9 out of 10 pain or 10 out of pain, but I'm sending them to the emergency room or their PCP and they're going to get acute care or crisis care.
Right.
But
right.
Many of the things that are chronic diagnoses, condition, whatever, for example, when someone has severe migraines and nothing else works, or they're actually having a heart attack and nothing else works, you know what they actually give them? They give them IV magnesium, vitamin when it comes down to it. Why? Because it's known as the relaxation vitamin, and it actually relaxes the heart and relaxes the blood vessels. So when things go down, so during the pandemic, they did a whole study on who had lowest outcomes. They actually turned out that the countries that had the highest vitamin D3 levels also had the lowest amount of positive cases.
Interesting.
So that's the thing. It's like, are vitamins and supplements, like, they're in foods, is what we eat. Does anyone have a medication? Name any medication. You said, which medication did you say? Let's say metformin, whatever it is.
Yeah.
Do you have a metformin deficiency? Does that exist? But no. Can you have a vitamin C succinate deficiency? Right. So how people don't have deficiencies in medications, but you can have deficiencies in minerals and vitamins.
Right. So it's interesting because you were talking earlier about like how there's different correlations between our physical health, our emotional health, our mental health, our nutritional health, right? And so my sort of clinical expertise is in psychology, and I work a lot with folks who deal with psychosomatic symptoms and psychosomatic presentation of anxiety, depression, that sort of thing. And they come to me and they're like, my stomach hurts all the time because I'm anxious, right? They're like, what do I do about that? I'm like, well, you have to treat your anxiety, right? You have to figure out what is causing you stress and what you're doing in your life that is causing stress, and your stomach will go away, right? And a lot of times it's so much bigger than just like, oh, I'm stressed out and that's giving me a stomach ache, that's giving me, gastrointestinal problems. A lot of times it's also like, okay, well, when you get stressed out, do you then binge on an entire box of Oreos, or do you eat an entire tub of ice cream and then your stomach hurts, right? Or was it organic to the stress, right? There's often so many more things tied to it besides just like, oh, I felt stressed and then my stomach hurt,
sure.
Right?
Well, a gut microbiome brain axis that goes on. So there's this popular cranial nerve called cranial nerve 10, the vagus nerve, that we learn. And basically the vagus nerve is what brings us into a parasympathetic state. So we know it as a rest and digest state. Turns out that the gut communicates to the brain through the vagus nerve. And everyone's very into probiotics right now. Well, postbiotics is the signal that activates the vagus nerve that tells the brain how to feel and what to think through an acid called butyric acid, also known as butyrate. So the perfect example is, let's say we'll go with anxiety. I'm not saying this is the reason why they may or may not have anxiety, but if you eat, cake and candy, how are you going to think that day?
Right. You're going to feel right.
And what if we eat all those healthy foods? What is going to be your mood and what's going to be your thoughts? So when someone says they have butterflies in their stomach or they feel anxious in their stomach or stuff like that, there's actually a lot of truth to it. So it actually turns out that a lot of psychological conditions through the vagus nerve comes from the gut microbiome brain axis. And they used to think that there's this huge blood-brain barrier that really picks and chooses what goes inside the brain. And let's just say that blood-brain barrier is more leaky than we give it credit for.
Mm-hmm.
So when someone gives antidepressant or antipsychological, it comes through a pill that you swallow. And if you think about it, that you swallow, that you digest, and then it goes up to the brain.
Mm-hmm.
So it turns out that they call the gut the second brain, and the vagus nerve is actually not a two-way street that we thought it was.
Mm-hmm.
So I hate to say it, but a lot of our thoughts are actually the thoughts from our gut.
Mm-hmm.
So when someone has a leaky gut and they have a lot of psychological conditions, once you work on the leaky gut, a lot of those conditions may or may not, get better.
Right. Well, it's like that, the age-old saying of like, trust your gut is a super true thing, right? Like you often get that pit in your stomach, like something bad's about to happen, or you don't trust somebody who's around you, or whatever the case is, right? Like there is a reason that saying has been around for, ages and ages and ages. And there's a reason people say, trust your gut. Your gut will tell your brain things that are going on, right? And therefore you have to treat your gut appropriately, right, or well, so that your gut will send positive signals to the rest of your brain, right, or to the rest of your body. To your point about like, if you are eating crap, you are going to feel like crap that day, not only probably because your sugar levels are going to be all over the place and all of the physiological reactions you're going to have, but also like, if you are eating shit all day, you're not going to feel like, oh, I'm really proud of myself that I'm taking care of my body and I feel healthy and strong. You're going to feel lethargic and weighed down by the high sugar, high fat content that you're eating, right? Absolutely. So it's kind of a vicious cycle. If you want to take care of your brain, you have to take care of your body. And if you want to take care of your body, you have to take care of your brain.
There you go. I have a gut feeling that people will like this video today.
I think that you are spot on with that. And I know we only have a couple minutes left, so I want to open up to folks if they have any questions for you. You've given us so much awesome information about, our body and how to take care of it and debunk some myths about, medicine and, the way that our mind and body interact. So opening it up to anybody, plug it in the comments if you have some questions for Cal. And Cal, if there's anything else that you wanted to share with us before we sign off today.
Sure, yeah. In the meantime, when people are asking questions, I really enjoy, I will play on Forster Your Health or Forster Your Awareness. And I just want patients and want people to start doctoring themselves. Mm-hmm. And I want to give them that opportunity to take in power and not feel like they have to wait till they end up in my office or anyone else's office to cure all their issues, that they have the choice and every decision they make, which play dividends. Because at the end of the day, they spend, let's say, 30 minutes in my office, but guess what? Mm-hmm. They're doing the other 6 days a week in 23 hours and 30 minutes, not in my office. Mm-hmm. So it really comes down to what are you doing not in my office is almost sometimes more important than what ends up happening within my office.
Absolutely, yeah.
So it says, so I'm a type 1 diabetic that is trying to lose weight and gain muscle. I try to minimize carbs and maximize protein, but it's hard because occasional low blood sugars force me to eat carbs. So that's a great question. I just want to preempt by saying I'm not here to give medical advice to anyone, mm-hmm. and that's not my. So you should speak to your PCP, especially with being a type 1 diabetic. But I could generally speak on the rule that becomes why maximize protein, because there's a concept called advanced glycation end products, which is called AGEs, but it actually converts your protein that you don't use actually gets converted into carbohydrates, which gets converted into sugar. So this whole concept of high protein diets is actually not as necessary as people make it out to be. It turns out that the reason why people need protein is for acid, but it turns out that we utilize 60% of our own essential amino acids within our body every day. So really 30 to 40% coming from a protein source.
Right.
So I think that's a little bit. Also, the thing is like, what type of protein? Is it coming from, grain-fed, antibiotic hamburger? or is it coming from a wild caught piece of sardines? Right. That's the protein. I will say for this individual that I have a lot of success with essential heavy fats. We alluded to with the avocado, olive oil, also MCT oil works great. Vinegars. Apple cider vinegar does not break your fat. White wine vinegars, balsamic vinegars, and coffee does not break your fast. Tea does not break your fast. And also, I'll just leave it off with this. People are so afraid to be hungry. People think they're going to starve to death. People for decades and centuries of years went on to be hungry. And guess what? You get hungry for a little bit, and then you move on with your day, and guess what? You forget that you're hungry.
Right.
So being hungry is not necessarily such a bad thing. It's okay to be a little hungry once in a while.
Yeah. And it's important to listen to your body and in some ways wait till you're hungry to eat, right? Like I think we live in a society where food is so connected to like social interactions and things like that. And so many of us eat because we're bored, eat because we're stressed, eat because our emotions are telling us to, not because our actual neurological system is telling us to, right? Our nervous system is cueing hunger to tell us that we actually need to be nourished, right? I also just want to comment quickly, again, not a medical professional, and again, not giving medical advice, but based off of what I know about nutrition and health, speaking on what Bobby was asking about protein versus carbs are not inherently bad, right? Again, I think this comes with like the diet culture that we live in, where it's like, oh, I have to get rid of this to lose weight, or I have to add more of this to gain muscle, right? Carbs are not inherently bad. Just as Cal was saying, protein doesn't inherently gain muscle, right? It has to be a specific type of carb. It has to be a specific type of protein that your body will then process into fats, muscle, or burn it, right? And so I think that's one thing to be really intentional about, is that protein, fat, and carbs are not inherently good or bad in what they are, right? You have to be intentional about the type of carbs that you're eating. Obviously, you have to be specifically intentional if you're working on balancing insulin, right?
Absolutely.
But I mean, carbs inherently are not bad, right? Well, now, if we're talking about eating a bagel versus eating,
a sweet potato, different,
right? But carbs are not universally bad. So just want to throw that out there.
In one of the blue zones, the longest living centenarians in Okinawa, Japan, they were the third longest population per population of people who live to 100 years old. 85% of their diet
is rice,
purple sweet potatoes.
Oh, interesting.
85% of their diet was purple sweet potatoes, and per 100 population, they had the third longest living people on the earth.
See, there you go.
It just shows you, with the right types of resistant starches, what that can do for the body. Because at the end of the day, you're not feeding your carbohydrates. It's not calories. It's not protein. It's not fats. It's such a joke already with all this stuff. It's not percentages. It's what are you feeding your microbiome? What are you feeding your body? What are the messages you are sending to your health? It's about food choice. It's not about calories. It's not about protein. It's not about fat. It's not about carbohydrates or percentages. That is old school nutrition thinking, and we still learn it for some reason. That doesn't matter anymore. I never will tell any patient I ever have how many calories to eat or any of it. We have foods that you should be eating, foods that you shouldn't. We could do allergy testing. We could do all different types of stool testing and analysis, and we could figure out what you need. But I'm not telling you how much protein to eat anymore. That is done. Over. It's not the way food is medicine. So I just had to reach that.
No, I appreciate that. And I know we're past 8:00, so I will leave you with this one last question about gut health. Somebody was asking about utilizing kimchi, kombucha, or kefir in the case of gut dysbiosis. I think I'm pronouncing that correctly.
Sure. So no, that's a great question. So what all those are called they are naturally fermented probiotics. So, for example, we think of grapes, fermented grapes is wine, right? Um, and then fermented could be yogurt, or so that's what kefir is. Vinegar is fermented. Normal apple juice becomes apple cider vinegar. So everything is fermented. So sauerkraut, pickles are fermented cucumbers, right? So the idea is once it's fermented, those are natural probiotics. So everyone gets so excited about taking probiotics, and I think it's good. I take probiotics myself, but that's naturally fermented probiotics in food. So which is excellent because you're feeding the gut and giving a diversity of microbiome. One asterisk I'll put on it is, like everything, marketing companies and food companies love to jump on these things. So all of a sudden they say kombucha, right? And they're like, oh, kombucha is great. And kombucha is great authentically. But guess what? They make kombucha sodas and kombucha foods and yogurts and everything. And you turn the label around. And did you know there's over 3,000 different ways of naming the word sugar? So, well, all right, I know I can name maybe like 12 off the top of my head. I can't name the other 2,500 different names for sugar. Xylitol, allulose, stevia, monk fruit, glucose, fructose, high fructose corn syrup, you name it. There's a million ways of saying the word sugar. So it says kombucha, big on it, and maybe they like make a million different words of saying sugar so they can put the word kombucha as the first thing on the ingredients list and all these other things. And then all of a sudden people think they're being healthy drinking this kombucha soda or kombucha drink. And then all of a sudden they're getting sick, or the kefir, and then it also has, corn syrup on the bottom of the kefir yogurt. So it's like one of those things. In its truest sense, it's amazing, and that's part of the reason for longevity in Asia. But let's just say, be careful, foster your awareness, read all labels. If you see one ingredient that you know or don't understand, put it back. If it says fermented sauerkraut and that's it, you get it. If it says fermented sauerkraut and 14 other things, it's not helping you. It's not.
There you go. Well, Cal, thank you so much on all of your fostering of awareness tonight. It was great talking with you, and I'm sure folks will have several other questions. So we will save this live to the Speak Wellness page. We will tag Cal so you can connect with him directly. Cal, also, if you want to plug in your handle in the comment section now so folks can go give you a follow. Definitely, we will save the live, like I said. Come back to the comments, ask your questions there. If we didn't get to them tonight, I'm sure, Cal, we would love to have you on again in the future to debunk some further myths. Thank you, everybody, for joining us, and we will see you on a Tuesday again soon.
I appreciate it. Thank you. And shout out Speak Wellness program.
Thank you. Bye.